Good afternoon, everyone. Welcome to the Board of Directors agenda meeting for May 30th, 2017. Thank you all for being here as we review the agenda for our upcoming meeting on June 6th. The first item is a presentation that I'd like to call on folks for, the Arkansas Health Impact of Housing Project. And I understand Lita Anthony is going to take care of us on this. Lita, welcome.
Good afternoon. Well, I get to do the first leg of this run.
Okay, good.
Mayor Stodler, member of the Board of Directors, thank you for this opportunity to provide to you an update on a health impact assessment. That we've properly named Affordable, Safe, Quality Housing for All. This health impact assessment, which is being done in conjunction with the Pew Center, the Robert Woods Johnson Foundation, and the Center for Disease Control, has focused on the residential areas south of I-630. The Arkansas Community Organization, Central Arkansas Reentry Coalition, Central Arkansas Legal Services, UAMS School of Public Health, Bowen Law School, members from the Veterans, Landlord, Property Management, Returning Citizens communities have done this work for about 2 years. We have involved the community or engaged the community in our work through focus groups, surveys, data collections, literature reviews and summaries, and lived experiences. We appreciate the assistance to this project that has been provided to us by City Code and the IT Department of City Government. Housing is fundamental and foundational to the successful sustainability of every citizen in our city. Safe, healthy homes make for safe, healthy neighborhoods. Safe, healthy neighborhoods make for safe, healthy communities. Safe, healthy communities make for a safe and healthy city. We believe our work is closely related to the goals of the Invest Health project that is also being done in our city. We hope, as a result of this presentation today, that there will be room for us to collaborate. At this time, I'm going to call upon Amy Pritchard to share the presentation and some of our findings, and then I will close. Let me also introduce the members of the group that are here. If you would allow them to just please stand for just a moment.
Would you like to introduce?
Okay, we'll start with Robert Combs. Robert Combs, we have Kendall Llewellyn with Legal Service. Robert is with CARE. Neil Seeley is with Arkansas Community Organizations, and Larry is with Veterans Administration.
Very good. Thank you so much for being here.
Good afternoon. Thank you all for your time. Is there a button to advance forward, or? Oh, I tell you. Okay.
The human button back there, yeah.
Awesome. All right, click. Okay. So a health impact assessment is a standardized way of looking at public policy that uses data sources and analytical methods and looks at stakeholder data to determine the potential effects of a proposed policy, a current policy, and how it affects the health on a population. At the end of a health impact assessment, recommendations are made on monitoring and managing the effects of whatever the health impact is of that policy. Our work to date, and you can just go through all of this, as Lita mentioned, we have a Health Impact Coalition that has a broad base of healthcare providers, legal providers, and individuals who represent the returning citizens, as well as tenants and landlords groups. We've done several focus groups, surveys of tenants, and collected different stories from both tenants and landlords. We've also looked at public policy and the existing literature on health and its connection with housing. I'm going to the next one. Oh, sorry. Okay. And so really what we're looking at is what is the impact of housing policy? How does housing connect to health? And how does our current housing policy connect to the health outcomes that we're seeing in this city? This is especially important because nationally and locally, we're seeing a growing renter population. More and more individuals are not buying homes, but instead they're becoming tenants. And we've seen this over every age group, over every income, and different household types throughout the past 10 years. And there's a lot of data that connects health and housing, from the basic connection between asthma and mold. If you have mold growing on your walls, you may have poor health outcomes, but also the health impacts of individuals who are displaced or doubled up, or even the instability of not knowing whether you're going to have to move out. All of those different factors have an impact on health, and this is just a sampling of some of the data that's out there, but there's been a plethora of research done connecting poor housing conditions with individuals' poor health. Thanks. And this is just a graphic that shows what all of those different health impacts are. The affordability of housing, as you know, makes it difficult. People have to choose between buying food, buying medicine, and paying for their housing or paying for their utilities if they don't have a house that maintains heat and air. Lots of stress around that, parents having to worry about their children's health impacts and also worrying about housing stability. And it shows a lot in the inside, it shows a lot of the housing conditions, thermal standards, damp and mold, design issues, overcrowding, and safety hazards that aren't fixed that can lead to falls, accidents. We've heard lots of stories about pests and the pest problems on health, both on roaches and also rats and rodents that are impacting children and families' health. Thanks. And asthma is one of the most obvious. You'll have common asthma triggers in the home, and an individual will not be able to improve their health until those asthma triggers are identified and reduced. So this map is from a research study that was done elsewhere that shows the correlation between poor residential housing structures and asthma hospitalizations per 1,000 children. So you can see there's a connection between housing conditions and or poor housing conditions and asthma triggers or asthma hospitalizations. And overall, a good ventilation system, a good HVAC system with proper filters, proper functioning, heat and air safe, the vents actually properly working, the gas properly vented, improves health and decreases asthma, respiratory diseases, and headaches. So those are some really tangible health impacts of poor housing and poor housing policy. Trips and falls, as we get an increasing elder population, we also see an increase in unintentional fall rates, and a lot of those can be related to housing problems that, if left unchecked, will lead to other health impacts. And Arkansas, as you all know, has some of the worst health outcomes for both children and adults. And we also have some of the worst landlord-tenant laws in the country that have the worst protections for tenants. So we know that there are, Arkansas is one of the only states that doesn't have a Healthy Homes program, which would send somebody into the homes and inspect them and make recommendations on making improvements. We know that we have a higher asthma rate here in Arkansas than other states. And we know that those hospitalizations and other costs from health impacts cost all of our population. Give you a second to look at some of these statistics. And in 2007, Arkansas implemented what was called the Arkansas Residential Landlord-Tenant Act. It was based on the Uniform Residential Landlord-Tenant Act, which is a mirror. It provides responsibilities for landlords and responsibilities for tenants in 7 different areas, in codes, in cleanliness and health, storage of waste, maintenance of the dwelling unit, repairs and health, water supplies, and additional elements. And Arkansas implemented all of the responsibilities for the tenants and all of the rights for the landlords, and then it's a uniform law, so they cut out all of the rights for the tenants and all the responsibilities for the landlord. So right now, at the state level, we have a very one-sided landlord-tenant law that has a lot of responsibilities on tenants to maintain their units, but no complementary responsibilities for landlords. We did, a lot of our work this winter was focused on House Bill 1166, which was going to be what they claimed was an implied warranty of habitability, but it actually was going to have landlords in places where there was a building code meet 3 or 4 basic things, and if a tenant complained and those weren't repaired, the tenant would have to move out. So it really didn't give tenants any more rights or make any more responsibilities on a landlord. But you really need to have the complementary responsibilities on the landlord and on the tenant to maintain the dwelling, because a lot of times we hear from landlords that their tenants are causing problems in the household. So you need both of those working together in order to have a healthy and safe home. And this is just a map. Arkansas is the only state that doesn't have any bottom warranty of habitability, saying that when a tenant goes and rents, they don't have any expectation of a safe and healthy home. So we're the only state that doesn't have any landlord responsibilities, but we do have those tenant responsibilities that are spelled out in the 2007 law. Little Rock does have a rental inspection ordinance, and it does provide a very good baseline with building, housing, and code, but it doesn't give tenants any sort of private right of action other than complaining to the city, where the tenants can go and make a complaint to city code and city code can take care of it. But a warranty of habitability would give tenants a level of an ability to enforce that in various ways. In different states, they have different ways to enforce that, but some sort of private right of action where the tenant can actually take steps to make sure that the landlord makes the repairs as well. And I will pass over to Lita Anthony.
As we stated before, our work is not finished. One of the end products that this team intends to provide is a website for renters that actually gives them an education as to the things that they need to look for. We've had renters tell us that they rented in the wintertime, so therefore they didn't take the air conditioner. When they went to turn on the air conditioner absolutely did not work. So these are things that we want to address. We also want tenants to know the law and to be proactive in how they go about actually looking at properties that they may tend to use. We want to refer you all to the 500 Cities report that was done by the CDC that actually talks about the health of Little Rock. It was one of the 5 cities in the state of Arkansas that was looked at to talk about the different areas where different types of diseases and stuff are so prevalent. And so we were right on target when we looked at I-630 and the dividing line and the issue of respiratory diseases that is also caused by infestation. We will be back hopefully after our report is completed and we have satisfied our grantors in making sure that we provide to them the information that they were looking for and the process that we executed it appropriately. So we request that you join us in this work. And again, Mayor, I know that you're on the Invest Health piece, and again, we collaborate for future work. I think would be something great since we both enjoy the same funder for this project. So if there's no questions, or again, we'd like for you to look for our report as well as our website.
Well, thank you, Lita. There may be some questions from board members. Let me call on Director Hendricks first, please.
Thank you. I would like for the young lady to come back and place emphasis on what you said about this state not being in compliance as far as the landlord's expectations. And I think Tom I hope he took some notes. Do you know what I'm talking about?
Well, Tom knows. So Arkansas is the only state. We used to be Arkansas and Alabama were the only states, and Alabama passed a minimum standard statewide where all landlords are expected to provide, if you rent a unit, your expectation then is that it's somewhat livable. It's going to depend on how much you're paying, but that there's that basic livability. And in Arkansas, that's not true. So you could be missing a roof, your door could be missing, your air conditioning could not be working, and statewide, there's nothing you can do.
So would you appeal to this board to sort of really be serious about that? I don't sit here and listen to speeches just to hear speeches. Yeah.
Director Hancock,
the appeal is going to
Director
come.
Tom is
The appeal
Hendricks,
is going to come.
I
From
think
the
we are
residents.
serious about that. The real inspection order code that the city has does put those requirements in place for any landlord who wishes to lease property to another person. I think the point that's being made here is that virtually every state in the union except Arkansas has this embodied in
Is that
state
good or bad?
statutes. That's bad if
Okay,
you're a
well, that's-
tenant.
that's
It's
real.
great if you're a landlord.
Okay.
We
So-
are a landlord-friendly state.
So,
Yeah.
Lita, would you appeal to this board?
There are different measures that we hope, we will come back with local recommendations as a part of our final report that we hope that you will take consideration of as we go through this. This problem is not, our target population was south of I-630, but, we all were crushed when the child was eaten by rats and those issues surrounding how they lived. We were upset when just in Saline County, in one of our nicer apartments, mold was taking over and making people sick. And we see those issues all around the state. The issue of warranty of habitability is a state issue. We just happen to be looking at that small target population where we get concerns from returning citizens because they can't afford, they have the criminal background, and they have to take whatever is out there. We hear from just people who are low income to begin with, and the standard that they are forced to live in. And if they complain, they normally call code, and certainly code goes out and tries to address those issues, but that's when the eviction notice comes to most of us, and we do have the data to support that in most of our instances. It's an issue that, we hope we get addressed because it falls on our children and the health care that they need for the future.
So it is a state issue.
It is a state
Okay,
issue,
and-
yes.
And we can,
There are
like-
some local efforts
Yeah.
that we can take, yes.
Thank you.
Director Hines, you recognize, please.
Tom, again, so we are pretty limited in what we can do as a city. I know sometimes we can be more restrictive than the state. Is this a case where we couldn't, if,
What we cannot do is we cannot pass an ordinance that's contrary to state law. There really is no state law that deals with the issue, so our ordinances can be passed at this point. The
Okay.
state has not tried to preempt our ability to deal with the health and safety of its citizens.
okay, thank you.
And if I may, and you can stop me if you want, Tom, but I think, Little Rock does have a really good rental inspection ordinance, but the issue is when enforcement, and that's the challenge when in every other state, a tenant has a private right of enforcement where the tenant can take matters into their own hands as well as calling code. Because we have no protections. If a tenant calls code, they can be evicted. So there's no basic protection for them for calling code. And if the process is slow or the landlord doesn't make the repairs, ultimately it could lead to condemnation or the tenant just having to move. But, we're also the only state that criminalizes non-payment of rent. So if a tenant withholds rent, they can face criminal charges after receiving a notice to vacate. So it's really difficult for a tenant to assist the city's efforts in improving housing conditions, because really their only option is to call code, wait and see if the landlord complies, and/or move.
Have you researched yet whether there's a common law cause of action for a tenant to pursue an issue such as, obviously, if the commode is failing and, I'm taking
Right.
a more exaggerated kind of an example, but is there a common law right of action?
Arkansas, there's some recognition for constructive eviction. So if a tenant moves out, they can terminate their lease. The same as constructive termination in employment. It gets so bad that they just have to move out and can cancel their lease. But we've done a lot of research. There's nothing else recognized in Arkansas. The case law, all of the caveat lessee case law is all in tort. So there isn't a good contract basis. It hasn't been decided either way, is my opinion. But we've currently got a case before Judge Gray where we're making that argument that there should be a judicially recognized.
If there's a lease executed between the parties, then there could be an action taken
Right.
based on,
Yeah, if there's a
that issue,
lease,
but
an
that'd be a-
agreement to repair in the lease, yes.
Director Hendricks, you're recognized, please.
I wanted to come back and to let the board, what I was making reference to is that this board could submit, as we did about 4 years ago, we attempted to do something with the landlord, but we didn't have any luck. So my reference is that this board could recommend to our state legislators. I know full well there's nothing we could do. Thank you. As a broker.
As we come back with recommendations and as at the end of the report and also with the website itself, once it has been okayed by the Pew Centers and Robert Woods Johnson as to its contents, we hope that there is some workability there because, again, housing is foundational to whatever we're doing in this city, and the right to affordable, safe, healthy housing should be the right of every citizen.
Well, and I wanted to clarify, the constructive eviction cases deal with not having to pay the rent. They really don't deal with getting the
They won't get
tenement
it fixed.
fixed.
Yeah, if they move out, their obligation to pay the rent, then, well, if they are sued, then they have a defense to non-payment of rent. There's not really,
There's
Yeah.
not a cause of action that they can bring, right?
Thank you very much.
thank you.
Okay, that concludes the presentations for today, and you'll notice that we have 3 other recognitions or presentations to deal with on next Tuesday. We can now go and look at the agenda. Mr. Moore, do you want to explain the deferral on item 20, please?
Mayor, members of the board, this item was deferred at the request of the realtors initially. Then we agreed on a date, and then we realized that our key staff person is going to be out on that date. So that's why we're asking for it to be referred until June the 20th.
Okay, good. Now, if you will, look at items 1 through 19, and let me ask if there's any questions on any of these items. Director Adcock, yes. you're
I would like
recognized.
some information on item 17, please.
Thank you, Director Adcock. I was going to bring that up when we got to it. The resolution, I passed out an updated version of this resolution to you since I initially announced it. And I'll direct your attention to what I think is some very important positive elements to our local school district, which I think prompts this. First of all, I think it's very timely and appropriate for us to consider this, and let me explain why. I understand in June of this year, the State Board of Education is going to take up the issue of whether or not to set a date for return of local control to the Little Rock School District. And I think it's important for this community and for our city to exercise and hopefully take a position on this matter. This is written in a very positive way about the kinds of things that have happened in our city that reflect very favorably about what's happened since the State Board of Education took the school district over 2 years ago. And so I had an opportunity since last week to do a little bit more research on Act 930 of 2017 and to elaborate on those issues. And I'll point your attention to line 30 on the first page, where it indicates that the Board of Education, in determining the school district's level of support, can take into consideration not only the performance level on statewide assessments, but also other criteria that they deem appropriate. And then I went on and for the next several whereas clauses have identified a variety of things that the school district has advised me on that are very, very positive issues, such as the most national merit semifinalists in Arkansas, that on the state-administered ACT Aspire exam, 27 of our Little Rock's elementary school schools rank in the top 10 in the achievement category, in achievement in at least one category. $24 million worth of scholarships to our graduating seniors, $19 million worth of community volunteer hours donated, and so forth. And actually, there were several things, so I added an addendum of a variety of all of other issues. There's probably, I think, probably 15 or 16 of those in addition to the ones that I felt were very significant. And so in reading Act 930, it allows, and you look on line 11 of the second page, that anytime after the second full year of assuming authority, this Board of Education has the authority to take any number of steps to expeditiously return the district to local control. And one of those alternatives is to set a date to call for an election of a new school board. And then then finally, probably most importantly, in line 17, reflecting the fact that it's in the best interest of the positive growth of the city of Little Rock and of all of our citizens to come together, to be involved in this decision to ensure that the Little Rock School District is an excellent choice for education in Central Arkansas by returning the schools ultimately to control of an elected board. So this is simply asking, and I think in a very positive way, that the school board set a date for an election to be held for a new school board in accordance with Act 930 of 2017. And to and in light of the fact that they're going to bring this up in June, I think it's important that this city board take a position on it. I did see this, and I think many of us did see this, distinctive from the school millage issue, which I felt was separate and apart from this. So I think it's an appropriate opportunity for us to give a positive suggestion on why we think it's time to begin to discuss a timeline on when local control can be returned.
Well, I was at the Board of Education today for about 4 hours, and I talked to Johnny Key, and he said there was no set time whatsoever for this to happen, and no June was ever mentioned. Also, one of the members said that when she receives this, that she's going to write us back a letter and say that they want us to do away with murder in Little Rock. So, I think that out there, they've got kind of an idea that we think we can tell them what to do, and I will not be supporting this.
Well, we're not telling them what to do. We're just suggesting that we think this would be very helpful and I think healing to the city of Little Rock. Director Richardson, you're recognized, please.
Yes, thank you, Mayor. The previous version had all of our names listed on it. Is there some policy or procedure reason why our names are not listed on this?
Say that, I'm sorry,
The
what?
previous version, I think we had all of us listed as sponsors or co-sponsors.
I had heard that there were some people who didn't want their names on there, so
Well, let me say
what
clearly.
I was going to do is I was going to go ahead and offer to put whoever's name on this resolution who
Yes,
would
sir.
like to also be a co-sponsor.
Yes, sir. Let me say clearly, as a graduate and an ardent supporter of Little Rock School District, I would like to have my name included on this, and I think
Very
it's a
well.
wonderful idea.
Vice Mayor Webb.
Thank you, Mr. Mayor. I have a question on page 4, on line 19. And while we have 3 members of the city board who are proud
Page
graduates of Hall, I'm wondering about that.
That came from the school. If you would like me to double check that, I will.
I would question
All right?
that based on the fact that Hall is one of
I
the...
actually had seen that earlier and meant to follow up on that. I'll see whether that's a typographical error.
I think it is.
But I did receive this information from the school district, so I'll just double check that. Thank you, Vice Mayor Webb. Director Wright.
Mayor, thank you so much for bringing this forward. This takeover has been very divisive in our city, and people have been very, very upset. We've been inundated with emails, presentations down here, people speaking to us, asking us to take a more assertive role. We have tried to understand that, make them understand that, no, we cannot tell the state what to do. However, we can make known how we feel. I think that this is a very good step. I appreciate you and applaud you for taking this initiative to do this. I would like to sign my name to it. I'm gonna be frank with you. I really don't care how they view us, Director Adcock, or us. We're not trying to tell them what to do. These schools are in our neighborhoods, and I do feel like we have a right to say something. And I don't see that there's anything wrong with this. There's some very positive things going on in the Little Rock School District, and I think that we need to take a position and make all of that known. I think this document does that, and I think it does it effectively. Whether or not they accept it in this spirit which is given, that's up to them, of course. We would hope that they would. We have a responsibility to our constituents to let them know that we are trying to do everything that we can to persuade the state to relinquish control back to an elected body. And I think that would calm a lot of nerves in Little Rock and perhaps get us on the road to healing. So I'm very, very supportive. Thank you, Mayor.
Director Richardson.
Yes, thank you, Mayor. On the line where you made reference to the number of National Merit semifinalists, I think Little Rock School District leading the state dates back to many moons ago in terms of doing it annually. And I'd like to recognize that that's been a positive effect and one of the positive outcomes that our district have had for a long time. And I think it's one that, once again, as a graduate of Little Rock School District, one that I've held my hat on in terms of being proud of. And I don't know, I could be wrong on this, Mayor. Is the Little Rock School District the only district in the state that was taken over that wasn't any kind of fiscal distress?
Director Richardson,
But no fiscal distress. And is that recently, Dean?
well, as we know, there have been other school districts been taken over. Pulaski County Special School District was taken over and then returned back to a local school board. So just recently. Director Peck, you're recognized, please.
Yep, thank you, Mr. Mayor. I would proudly like to add my name to this resolution and just echo what everyone else has said about it being a much-needed move towards some healing in this community. And I especially like the Exhibit A, and I hope that we can communicate this through maybe the Democrat Gazette. It's because I think a lot of people are not aware of some of these statistics that show the strength of the Little Rock School District. So I would be very proud to add my name.
Very good. And of course, Director Wyrick, let me call on you next, please.
Director Webb and I served on the Civic Advisory Council for about a year, and we provided an ending paper that went to Mr. Key and to the school district or school board, state school board, and in that we asked that they provide, they set an election date, which I think was last year, right? Last year, to bring back local control to the school district. So I think this is helpful. Maybe they don't know all the good things that are going on currently with the school district, and this does outline a sizable amount of things that are still going on, even though they show our district in distress. So I'll be adding my name to the resolution as well.
Very good. And assuming this passes, I intend to personally deliver it to the governor and have a conversation with him about it, as well as the commissioner and the school board members, the state education board members as well. Okay. Anything else on the consent agenda? If not, we can move on to the planning and development items. We've got a lot of them. Items 20 through 35. Anybody want anything on the first page? Which one was that, Director Adcock?
22.
Oh, okay. We're going to go over to item 22, please.
Let me,
You want,
Mr. Brzezinski to come forward. This is his next to last board meeting, so he's getting too excited.
Thought I had 3 more. Director Adcock, Mayor, Vice Mayor, members of the board, item 22 is property located on the east side of Mablevale Pike in the 3400 block. It's currently one track that's occupied by an auto repair facility and a multifamily, 2 buildings that make up the multifamily use. The request, and it's zoned I-2 light industrial, the request is to rezone it to planned industrial development, obviously to continue the auto repair, but also to recognize the multifamily. And in addition to the planned development, they're proposing to create 2 lots, one for the multifamily and one for the auto repair. And this was on the consent agenda at the Planning Commission and was 11-0 vote.
Okay. Then on item number 24, and this might be for Mr. Moore. Mr. Moore, I was on Battery Street the other day at 16th and Battery. Did we ever make a decision about stop signs or something to control the traffic at that location?
We have, and if you were over there, you might have noticed some of the things we've done.
No, I didn't.
Well, they're installed, and I've been through there a lot, and it's, I think, had a positive impact.
What was installed?
They're almost called bump outs that narrow the street at the intersection, and also I believe there's some ballards that are up there at the intersection on both sides. And that's, that has a proven effect of slowing down traffic through there.
Okay, thank you. Thank you, Tony.
Director Wyrick, you recognize, please.
Thank you. I would like a presentation on item 32 and item 36.
Brzezinski.
Director Wyrick, Vice Mayor, Mayor, members of the board. Item 32 is property located at 8222 Stagecoach Road. That's just a little bit east of Crystal Valley, between Crystal Valley and I-430. The property is approximately 5 acres. It's currently zoned R2 single family and C3 general commercial. The request is a planned development for mini storage on the back portion of the property, and then a commercial retail center on the front portion. Mr. Carter, if we could go to the site plan, or sketch, excuse me. Again, the retail component would be that front building along Stagecoach, and then to the rear would be 12 buildings of a combination of climate control and 9 non-climate control storage. And then they providing the necessary parking in the front.
I think I read in there that they're going to provide boat parking and RV parking. Is that going to be in the front?
No, that would be as part of the storage area to the rear.
To the rear?
Mm-hmm.
Okay. And the other map that you had up, the vicinity map or the zoning or land use map, it looked like it's coming pretty close to some residential structures. I did not see any feedback from neighborhood groups. How close are we coming to residences on the, I guess it's Crystal Valley Road?
The western property line of this project abuts those houses that their property that you're referring to, but there's a pretty large buffer area along a good portion of that western property. and also property line, and also to the north, acknowledging the single-family residences.
Okay, and when you did notification to the neighborhood associations, did you do Crystal Valley neighborhood?
Crystal Valley Neighborhood Association and Southwest Little Rock United for Progress were notified.
Okay. So, what is there today? I'm trying to figure out exactly where this location is. That's what I'm thinking too.
I think it's,
I think it's also.
it had been used by a contractor. I'm not sure if that's still there or the property's vacant. I know it's been for sale.
Okay, was it Patton Wrecking? Does that ring a bell with you?
Yes,
Okay,
Lando Patton, yes.
okay. All right, so I know where that is. Okay. All right, but you didn't, I think according to the write-up, we had no comments from, or no one came to the planning commission to object.
It was on the consent agenda. It was 11-0 vote by the commission.
Yeah, I saw that. Okay, you want to go to 36? That's one that you're recommending denial on?
Yes. Item 36 is located outside the city limits, but within our extraterritorial jurisdiction. It's just property north of Lawson Road, and the request is to rezone from R2 single family to planned development commercial for a contractor's office and equipment, or what we call a contractor storage yard. Staff is not in support of this. In this general area over the years, like the property directly south of the site in question, it is zoned planned development commercial, but that had a long history of non-residential use. And even almost off the map on the south side of Lawson Road, that planned commercial development, also a long history of commercial use. So in this general area, we have recognized those uses, that non-residential uses that have been in place for a number of years. This particular piece of property, we were unable to determine that it had any non-residential use. I think the applicant will say otherwise. But also, we did not envision this area to be a large area of non-residential zoning, such for a contractor storage area, to begin expanding the amount of non-residential zoning here. Now, as you go back to the east, that area being at some intersections that has developed, and with auto dealerships and things like that.
Right.
But
And a
moving
Family
west,
Dollar.
we're
There's a Family
concerned.
Dollar somewhere, is that where that
That's that
PCD?
PCD at the city
Okay.
limits.
Okay.
Moving west, we're concerned about the expansion of this non-residential zoning.
Okay, are all these residential units that are between the PCD and Hope Lane?
I'm sorry, which direction?
West of the PCD for Family Dollar? Right. It's west of Family Dollar and east of Hope Lane,
I
in
think
between
those are
those
all
two.
single-family residences.
Okay. And there was a lady that testified that she was in support of doing this. Do
Yes.
you know where she lives?
Director Wyrick, I think she's west of the existing PCD on the north side.
Okay, and what's in the PCD?
That was Little Rock Electrical for a number of years, and now it's some kind of networking company.
And that's what the person that's wanting to rezone this said, was that the electrical company had a presence in this location. But it wasn't on this property?
I know he made reference to that at the Plan Commission meeting. I'm not sure if he was referring to this particular property or some other property.
Okay, thank you.
If you don't mind, if I could follow up a couple questions on that, Tony. So the properties to the east of this proposed site, are those all residential?
Mayor, I think they are. I can't tell you for, 100%.
So in your recommendation of denial, is it your belief that the rest of this property between Colonel Glenn Road and Lawson Road is going to develop as residential? I mean, it's zoned R2 now, so.
It's zoned R, but there's also some AF zoning, agriculture and forestry. But again, what we've done out here is there have been uses, non-residential uses that have been in place for a number of years, and we have gone in and recognized those. But I forget how many years ago, we had an application for a contractor storage yard further to the west on the north side, and that was denied by the Planning Commission because it didn't have any history of non-residential use.
So is this outdoor storage? Is that basically?
Typically, that's what's part of a contractor storage yard, equipment, sometimes materials and things like that.
Was there any request for it to be shielded or anything of that nature?
I don't think so, but I need to check.
What's the current use of the property now?
It's vacant at this time.
It's vacant?
Yes.
I mean, it indicates there's a pole barn and a metal building there. You think they're vacant?
Yes.
Thank you. Director Hendricks, you're next, please.
Thank you. On 24, Mr. Moore, do we have this type set up as what we have on Battery? I passed through there when these things were put up. Those things are really awkward. Where are these things? And I'm talking about these black railings that are sitting in the intersection. I know you all don't travel over there. Do you have those things anywhere else?
You mentioned 24.
No, 16th and Park, number 24. Am I on the right one? Battery.
And I'm sorry, what was your question?
Do you have these big black things sticking on the intersection in other parts of the city? And the reason why I ask you is because the residents are upset. We had one person who caused havoc, and I'm telling you, the community is really upset about it, Bruce. And really and truly, it's really a setup for a legal ramification of a lawsuit.
Director Henry, those have been in place for months.
I know, you know why they're there, don't you?
And, we have a park.
Oh, I know why they're there.
Across the street, and I felt like it was important as from a pedestrian standpoint.
This was brought to your attention, is that right?
Excuse me?
This was brought to your attention. I'm talking about when the stop signs were put up there. See, I catch hell from the community.
But to answer your initial question, yes, there are in other places of the city. There's some on Louisiana.
What in Louisiana? Downtown?
Correct.
Yeah, I mean residential.
Yes, ma'am. Well, some commercial, some residential.
Yeah, this came from the dispute by one neighbor about the stop signs being put at 16th. And I just want to let you know, so be on the lookout.
I think, I think y'all get a lot of complaints about speeding. And I just asked our staff to, besides a stop sign, what else could we do to help slow down traffic next to a park that's used a lot? A lot of kids walk to that park.
No, they do not. I live over there. You can't tell me that. Neither can the staff. Thank you. I'm not going to sit here like a stupid.
Director Hines, you're recognized, please.
Thank you. Bruce, I'd like a presentation on 37, please. I think Director Swanson's here.
This is a program that you all had approved as a pilot, and I think he's requesting it be permanent. So, Mr. Swanson.
Mr. Mayor, City Directors, I'm John Swanson, the Director of MEMS, and I'm pleased to be able to present to you the results of our BLS emergency trial. Slide, please. Began back in June of last year. It had to be approved both by the State Board of Health and the City of Little Rock. You all gave us permission to conduct this trial. And the reason is that the current state rules and regulations require a tiered system such as MEMS, meaning we have multiple layers of ambulances, ALS and BLS. that we're required by rule to use all of the paramedic units before we can assign a call to the lower level units. Slide. So the proposed rule change is in its final stages at the Department of Health, and this will allow EMS services with the dispatch center and the appropriate protocols to assign calls to BLS units for low-level emergencies. There have been no objections made in the process of the rule change at the Health Department. Slide, please. And excuse me, because I even made a note that I would not fail to introduce Dr. Mason, our medical director, who is here. Chuck, I'm sorry. I made a
Welcome,
note
Dr.
right here
Mason.
do
Good to
that.
see you again.
So the proposed rule from the Health Department would require that all dispatchers in the dispatch center have to be emergency medical dispatch, or EMD certified, that they use a system recognized and approved by the Department of Health. The medical director has to provide oversight for it, that a quality assurance program is in place, that any ALS intercepts on a BLS call are reported by every quarter to the Department of Health, and that we use a process that specifically and reliably identifies the appropriate calls for a BLS response. And I've used that acronym, let me be clear, that ALS means Advanced Life Support. That means a paramedic and an EMT. BLS means Basic Life Support, and that crew would be 2 EMTs. Slide, please. So at MEMS, we refer to the senior EMT on a BLS crew as a lead EMT. That person requires at least a minimum of a year's experience at MEMS. Most have more. They require additional training. And the medical director, Dr. Mason, has to personally approve each one of them to be designated as a lead. So all of our BLS units must be staffed by a lead EMT. Slide. We've designated some, but not all of the calls that are eligible for a BLS. We use a nationally recognized system, and then I've placed in front of you those little flip cards, if you will. And what that is what each of the ambulance crews carries with them in the ambulance, but by now they've memorized them. But it basically will identify by a simple code what the nature of the call is and the severity of the call. And I'll come back to an example of that in a minute. The clinical trial include quality assurance reviews and the medical director's involvement in evaluation. And the list is continually being reviewed. And I'd emphasize there is minimal financial impact because about 1996, the rules on reimbursement specifically for Medicare and Medicaid changed, and we are reimbursed based on what the care of the patient is needed, not on the type of unit that is dispatched. So we could send an ALS unit on the call, but if medical necessity does not warrant ALS care, we get reimbursed at the BLS level anyway. Slide. Trial results then, total emergency calls within the city of Little Rock over that period of time were 32,887. Of that total, 7.7%, 2,500 of them were judged as appropriate for a BLS. I did not show you the number that were actually responded to as a BLS crew because over time, as our staffing in BLS has increased, we're now up on a monthly basis, about half of the calls that are eligible for BLS are receiving a BLS response, meaning that we're still sending paramedics on half of the BLS eligible calls. And the reason we do that is so as to not delay the response. If the BLS crew is close, we'll send the BLS crew. If the BLS crew is not immediately available and an ALS crew is closer, then the ALS crew will still go to make the response quickly. So of the calls that we've been on, there were 14 where ALS support was requested. There were no negative patient outcomes with that, and at the risk of speaking for Dr. Mason, he has reviewed all 14 of those calls, and those were all done out of abundance of caution. They were not necessarily required in ALS support, but the BLS crews did that out of an abundance of caution. I'd emphasize, too, that this is not an effort on MEM's part to decrease ALS staffing. In fact, we're increasing ALS staffing. This is all done to add resources to the system so that we can improve our performance and response times overall. And we're adding resources. We are not decreasing ALS. We are adding ALS as we continue to increase the pace of training at MEMS. Slide, please. So we do meet all of the requirements of the Health Department. We have what our system is called Priority Dispatch, and those are the flip charts that are in front of you. You'll see that there are 32 natures of the call, and I'll get in more detail in my example. And then the level of the acuity goes from alpha to echo. The lowest acuity calls are the least serious. Those are designated as alpha calls. The most serious calls are designated echo, and they're tiered from alpha through echo. At the national level, actually, it's an international standard that we use. It says that all of the Alpha and Bravo calls could be BLS. We're much more conservative. Most, but not all, of the Alpha calls and none of the Bravo calls are sending BLS crews, nor do we intend to. And I'll show you in detail here in just a minute. Slide, please. This is a little bit of an eye chart, but these are the 32 determinants. And I emphasize the 17 and 26, the falls and the sick person. If you'll see on the slide coming up, well, you'll see how this works. But those determinants is the information that we get from the caller on the 911 contact with MEMS. Slide, please. And this is the first step in the dispatch process. We want to make sure we know where the patient is, that we've got to be able to find them. And the next thing we've got to get is a callback phone number, and in the event that we become disconnected. And then you'll see if exactly what happened. The first thing we hear, if somebody has a hanging or is in the water, it immediately shunts to a 9 echo, and so that means it's the highest priority. Then it goes on to, are you with the patient? And if it's a traffic accident, for example, how many patients are involved and so forth. And then it comes down to ask, is the patient breathing or coughing, indicating air movement? And if the answer is no, it immediately shunts to an echo, gets an ALS immediate response. Then the age and awake and so forth. And so all of this is defaulting to the highest level response. It is assumed to be an ALS response unless we have the assurance that it's a BLS appropriate. Slide, please. And then the next one is a little bit difficult to read. The ones at the bottom will tell you this is a fall, which is the 17, nature 17 in the flip chart. And you'll see that its deltas are the most serious. The Bravos are the still serious calls, only if the fall is a not dangerous body area, if it happened some time ago, or if it's simply a public assist to get someone back into their wheelchair or something to that effect. Otherwise, it defaults to the ALS level. Slide, please. This will show you of the eligible calls in the city of Little Rock during this trial. The red is the total number of calls in that category. The yellow is the percentage or the number of calls that would have been that are eligible for a BLS response. So to take you back to 6, which is a breathing problem, BLS doesn't go on those. 10, which is chest pain, BLS doesn't go on those. So you can see across where 17 is a fall, a fair number of percentage can be, and 26 is a sick person, which is a very generic statement of a person who is not well, not feeling well. But this is the actual distribution by the natures, and the yellow would tell you of the BLS eligible calls, how they break out. Slide, please. So my conclusion would be, and the request would be, that we have, I think, shown the efficacy of the BLS units in these lower acuity calls. It has indeed improved our system performance, and we would ask that the City Council approve this protocol going forward. And happy to entertain any questions, or perhaps Dr. Mason.
Very good. Thank you, John. Are there any questions? Any questions? You do a great job for our city and for the cities that MEMS covers. Thank you so much.
Appreciate council support. Thanks.
And thank you, Dr. Mason. Okay, other questions on any of the ordinances that we have before us? Any other questions? If not, yes, Mr. Moore.
Last year, you all received a report regarding our police vehicle program, replacement program, and we have worked extensively over the last 8 months working with the fleet. Mr. Hidden has done a great job along with Sarah and her staff, and I have a proposed 5-year replacement program that we will embark on this year. It will start with the city purchasing 60 cars this year, and then outline how we're going to do it for the next 4 years, which should allow us to get to a good point with our police vehicles. So I wanted to pass that out, and I will also be forwarding that to the FOP this afternoon.
Okay, it looks like we have a few people who have a couple of announcements. Director Peck, or questions?
I know I have an announcement, but this was, and Mr. Director Fortson, I think answered it, but it was about public hearings and who notifies people. There are a couple of little projects in Ward 4 rezoning that I probably wouldn't have a problem with, but being in the group that's supposed to be notified, and took a brief survey of my neighborhood, and no one got these notices. So I just was curious who does that? What's the process? Because I supposedly got 2 notices, and I would have gone to the meetings, but I was not notified. So does that come from planning or the developer or who?
Mr. Pazinski?
Thank you.
Director Peck, on rezoning or anything that goes to the Planning Commission, for the most part, there is responsibility on the developer to notify all property owners within 200 feet of the property, and also post a sign on the property. The city staff, the planning staff, sends notices out to those neighborhood associations that are registered with the city. But we find some aren't registered, and then other ones we find we don't have a contact. So we utilize the list that the city has for the neighborhood associations.
Okay, thank you.
Director Adcock, you're recognized, please.
Mr. Moore, I attended this Ward 2 and Ward 7 housing meeting the other night. And I think I've gotten used to the police department talking about they need more employees. But Mr. Turner was talking about they was like 10 code officers short. And it seems like they're constantly 10 code officers short. I understand 4 code officers this week was given their termination hearing. Do we not have a time of probation for code officers?
We do. As first I've learned that we have 10 vacancies, so I'll immediately check on that. I haven't heard about 4 code officers being terminated. There is a probationary period for all non-uniform employees, which is 6 months, and that's for all non-uniform. And if the policy says that within those 6 months, if the director feels like that person is not meeting the standards, then they can be terminated. After 6 months, they have full rights of any city employee, which means that if they are disciplined, they can appeal that. But during their probationary period, there's no appeal.
Okay, and on uniforms, code officers have on uniforms, also public works employees have on uniforms. I would like to see a copy of the uniform policy, because, you know, lots of times people don't take off their uniforms when they get off the job. They go and do chores, things that they need to be doing. Is there anything that says where they can or cannot wear uniforms, City of Little Rock uniforms?
I don't believe there's a policy that says that you can't wear your uniform after work. So I'm not aware of that type of policy.
Is there anything in policy that shows the code of how you should act when you have on the city uniform? Is it in a policy?
There are certain things that are outlined. One being conduct unbecoming of a city employee.
Does it spell out what conduct is unbecoming a city employee? If it's language, if it's where you find yourself, or?
It's case by case, Director Adcock.
Okay. I would like to have you get us how many people in the last 6 months and 1 year has been let go from the housing department, and see if they was on probation or what term they had been employed by the City of Little Rock. As well as I'd like to see the copy of the uniform policy for the city and also for the code of conduct if we have one for the city. Thank you.
Director Wright, you're recognized, please.
Yes, this is for Mr. Moore. Mr. Moore, we finished finally the work at from Romine down to, on 36 and Romine down to Shackelford. And, of course, the intersection is now widened, it's improved, it has the wider sidewalks, and they go all the way around, toward, Shackelford Crossing, so that the wheelchair, bound people are no longer in the street. Thank you. But I would also, I've noticed, of course, the increase in the traffic, and I wanted to know if we had done an analysis or a review to determine if a signal might be needed in that area.
Okay, we'll review that.
Okay, thank you.
Director Hendricks, you're recognized, please.
Thank you. Mr. Moore, I want to thank you for allowing us to do the tour from Arch to Martin Luther King, from Roosevelt Road to 33rd after the death of that young lady at 24th and Arch. And again, for the umpteenth time, can we sit and do something with this housing ordinance that we have? It's ridiculous. And I wanted to ask you, many months ago, we talked about the boarding of properties, whether we would have this nice, fancy. Did we ever get that?
We do that.
You do that? Okay, well, come and look in the block next to me at the houses. The board is going this way, it's going that way, it's not fitting into the, I'll send you a list.
Okay.
It's ridiculous. Thank you.
Director Wright?
Yes, one more thing, Mr. Moore. Recall, please, that the Housing Department had submitted a pro-champs policy that we were trying to get in Arkansas that would assist us with our foreclosed properties. Last I heard, it was in the city attorney's office. Have
And
we?
that's where it is.
And Mr. Carpenter, can you respond to that? Pro-champs, the initiative that I brought back,
Closure.
the foreclosure.
It's a foreclosure registry program.
No, I don't think so. I sure appreciate it. Thank you.
Okay, is there anything else to come before us? If not, thank you all very much.